Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, the link between dry eye and menopause, for people who are perimenopausal, nearing menopause, or already in menopause. There can be many symptoms to deal with, from hot flashes to night sweats and insomnia. In some cases, some people may experience the onset of dry eye syndrome. /r/n/r/n Dry eye affects about 61% of people in perimenopause and menopause. Menopausal people with dry eyes may experience light sensitivity, blurred vision, swollen lids, and increased tearing. These fall under the umbrella of chronic dry eye syndrome. /r/n/r/nVerywell, Jessica Olahrnrn/r/n/r/n It appears that fluctuating hormones may leave you vulnerable to dry eye. At this point, it's unclear exactly why those edging toward menopause or in the midst of it are more vulnerable. However, it's known that they do suffer from more dry eye symptoms. /r/n/r/n Here are a couple of ways hormonal changes may have an impact on your eyes. /r/n/r/n But just because you happen to be in either perimenopause or menopause and have dry eye does not necessarily mean that this is the cause. Dry eye can occur for a variety of different reasons. /r/n/r/n Dry eye happens when the tears produced are either of poor quality or when there are not enough of them. This can happen to anyone because of issues such as /r/n/r/n Women over age 50 have dry eye disease more than men of the same age. Research shows that for aging adults, 17.9% of women are impacted by dry eye versus just 10.5% of men. /r/n/r/n Some age-related factors that may also contribute to dry eye include /r/n/r/n Any steps to try to remedy dry eye must be done together with full consideration of these other issues. /r/n/r/n Hormone replacement therapy may be recommended to stave off unwanted effects of menopause like hot flashes and night sweats. The idea of hormone replacement therapy is to give female hormones such as estrogen after the body stops producing as much during menopause. /r/n/r/nHRT can help with a lot of problematic effects of menopause. In fact, estrogen may also combat some vision changes and ocular diseases that can occur at this time. /r/n/r/n Unfortunately, dry eye is also linked to changes in estrogen levels, which can be a real issue for some people. Those who undergo hormone replacement therapy are also 4 to 7 times more likely to complain of dry eyes. /r/n/r/n Fortunately, there are a lot of alternatives for getting relief from dry eyes. These can begin right at home with steps such as these. /r/n/r/n You can also possibly get an assist at the drugstore. There you may find a variety of over-the-counter, OTC, medications, as well as prescription options for dry eye such as the following. /r/n/r/n There are also some natural options for reducing dry eye. These include /r/n/r/n For those who are menopausal or nearing menopause, hormonal fluctuations can bring on symptoms of dry eye. Managing this can be done through a combination of approaches including diet, over-the-counter and prescription medications, and lifestyle modifications. /r/n/r/n If you're in menopause, it may seem that dry eye is just one more thing to worry about. Menopause can bring changes that are both physically and emotionally challenging. This is especially true when these symptoms are all occurring at the same time. /r/n/r/n When dealing with your dry eye, try to take this on a day-by-day basis and focus on what you need most at the moment to soothe your dry eyes. This kind of outlook may serve you well in navigating dry eye symptoms during menopause. /r/n/r/n During menopause, some people rely on hormone replacement therapy to navigate side effects such as mood swings, hot flashes, and vaginal dryness that can occur during this time. /r/n/r/n However, This is not without risks such as increased potential for breast cancer, and many of these symptoms pass after a few years. So, many people discontinue this therapy when they can. Hormone replacement therapy has also been linked to dry eye. Those who stop taking this medication may see an improvement in their dry eye. /r/n/r/n This appears to be linked to your fluctuating hormones. In particular, your meibomian and lacrimal glands may be affected by a reduction in androgen levels. These glands produce oil and fluid for our tears. The result may be tears with less oil that evaporate quicker and cause dry eyes. /r/n/r/n Also, some think estrogen levels may be a factor. This is why people who menstruate can experience more dry eye symptoms during certain times of the month. Likewise, those taking hormonal birth control pills can experience more dry eye symptoms. /r/n/r/n If you are taking hormone replacement therapy, this can also spur dry eyes. /r/n/r/n Symptoms of dry eye, whatever the cause, can always be treated with remedies such as artificial tears and gels. These can help restore the amount of tears available and also keep tears around longer. /r/n/r/n Use of prescription medications such as Restasis and Xiidra can also help to tamp down on inflammation linked to dry eye. Also, in some cases use of small plugs put in the tear ducts may likewise help to keep tears around. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.